Here is a detailed explanation of the functions of respiratory organs under Applied Physiology for Nursing, with emphasis on how these functions relate to clinical practice. Functions of respiratory organs, Applied Physiology for Nursing. Introduction. The respiratory system is essential for gas exchange, supplying oxygen to the body and removing carbon dioxide. It comprises upper and lower respiratory tracts and includes organs such as the nose, pharynx, larynx, trachea, bronchi, lungs, and diaphragm. Understanding these functions is critical in nursing practice for patient assessment, oxygen therapy, ventilation support, and respiratory care. Functions of major respiratory organs. 1. Nose and nasal cavity. Function. Filters dust, microbes, and allergens via nasal hairs and mucus. Warms and humidifies incoming air. Provides olfactory sense, smell. Nursing relevance. Nasal obstruction, e.g. from a cold or deviated septum, can compromise oxygen intake. Nasal cannula placement should maintain patency. 2. Pharynx. Function. Common pathway for air and food. Connects nasal oral cavities to larynx, esophagus. Nursing relevance. Assess for airway obstruction, e.g. swelling and allergic reactions or infections. Suctioning may be required. 3. Larynx voice box. Function. Conducts air to the trachea. Protects the lower airway with the epiglottis, prevents aspiration. Produces voice, vocal cords. Nursing relevance. Intubation must avoid vocal cord injury. Nurses monitor for voice changes after procedures. 4. Trachea, windpipe. Function. Main airway conducting air to bronchi. Lined with ciliated epithelium that clears mucus and debris. Nursing relevance. Tracheostomy care is vital in maintaining airway clearance. Suctioning techniques help prevent aspiration pneumonia. 5. Bronchi and bronchioles. Function. Bronchi divide into bronchioles, delivering air to alveoli. Bronchioles regulate airflow via smooth muscle contraction. Nursing relevance. Bronchoconstriction, e.g. in asthma, affects airflow. Bronchodilators and nebulizers may be administered by nurses. 6. Lungs. Function. Main site for gas exchange, O2 in, CO2 out, via alveoli. Store oxygen temporarily. Nursing relevance. Nurses monitor breath sounds, oxygen saturation, and respiratory rate. Lung function affects oxygen therapy needs. Alveoli. Function. Site of gaseous exchange via diffusion across thin alveolar capillary membrane. Covered with surfactant to reduce surface tension and prevent collapse. Nursing relevance. In conditions like ARDS, alveolar collapse occurs, requiring mechanical ventilation. Nurses monitor ABGs, arterial blood gases. 8. Pleura and pleural cavity. Function. Pleura, protective membrane covering lungs and thoracic wall. Cavity allows frictionless lung expansion with negative pressure. Nursing relevance. Pleural effusion or pneumothorax impairs lung expansion. Chest tube care is a nursing responsibility. 9. Diaphragm. Function. Main muscle of respiration. Contracts during inspiration to expand thoracic cavity. Nursing relevance. Nurses assess diaphragmatic movement during respiratory assessment. Dysfunction can lead to respiratory failure. 10. Intercostal muscles. Function. Assist with thoracic cavity expansion and contraction during breathing. Nursing relevance. In rib fractures, breathing is painful and shallow. Nursing care includes pain management and incentive spirometry to prevent atelectasis. Overall functions of the respiratory system, clinical perspective. Function, explanation, nursing application, gas exchange, exchange of O2 and CO2 in alveoli, monitor ABGs, O2 therapy, pulse oximetry, ventilation, mechanical movement of air in and out of lungs, assess respiratory rate, rhythm, and depth, perfusion, pulmonary blood flow for gas exchange, observe signs of hypoxia, cyanosis, regulation of blood pH, removal of CO2 helps maintain acid-base balance, monitor for signs of respiratory acidosis, alkalosis, protection, mucus, cilia, and immune cells trap pathogens, prevent infection, manage airway clearance, olfaction, smell, nasal cavity receptors send signals to brain, evaluate in neurological assessments. Larynx enables speaking and coughing, assess for changes in voice or ineffective cough. Conclusion. Understanding the functions of respiratory organs is essential for nurses to provide holistic and effective respiratory care. It allows for accurate assessment, appropriate interventions, e.g., oxygen therapy, suctioning, and prompt recognition of complications like respiratory distress, aspiration, or infection. Thank you. Have a nice day.